Hey, Dr. Brett here. I'm back with my wife, Chanakan.
Yes, I have a question about psychologists.
Okay.
If someone that talk about suicidal all the time, what do you think? Or yeah,
I mean, it really depends. I mean, it's a tough topic. Some people, it's very dangerous. A lot of times it seems that people that actually, follow through with it often don't give you warning or don't necessarily talk about it. Like Anthony Bourdain, some of these famous people that have killed themselves. It's not uncommon for the people that actually, succeed for other people not to know about it necessarily. So sometimes when people talk about it all the time, it's not always real. It's a way of getting attention, right? Now you have to be careful, and you need to be able to assess that. And you want to take people seriously, but if they're talking all the time about it, there's this concept called crying wolf. So sometimes it's like when you talk about it all the time, it doesn't it can be a form of attention seeking. So it really depends, and it varies, and that's why you often need professional help to sort that kind of thing out. But the whole thing's exhausting for family members. If you have a family member that's going through a serious depression, and there's real suicidal ideation, what we call, suicidal thoughts, and maybe in psychology you assess for suicide attempts, because the best predictor of future behavior is past behavior. So you want to find out, was there ever a suicide attempt, and what was it like? If it's 8 pills, then that's not a serious attempt, most likely, right? Whereas if they swallowed a whole bottle and downed alcohol or something, that's a very serious attempt. They could, very close to actually killing themselves. So you want to sort of assess the nature of that. But again, this is in the land of professionals. In terms of a lay person, obviously you want to try to take it as serious as possible, but you also want to understand the nature of what's going on, right? What's this really about? Is the person, is it a cry for help? Are they trying to get attention, or are they in the midst of some kind of really serious depression?
okay. If we are a friend of them, what should we do?
Well, if it's you want to convince them in some way to get professional help, and if they're not willing to get professional help, then you want to be there for that person as much as possible, but without burning out your own energy. Because if you're constantly listening to a friend that is depressed and suicidal, that can be pretty exhausting.
Yes.
People are trained to do that. That is not easy stuff.
Yes. Back then, I have like a client that I talk to often, and she has a depression sickness, and she said she tried to suicide a couple times, and she believed in like fortune teller bullshit, that she said someone predicted she will die at this year, and she like desperate and feel like, oh, I don't believe that much. It's just like someone say it, but then you make it happen.
Yeah, but this is in a realm where you want to, have that person talk to somebody that's a professional, because that's a dangerous. She is talking.
Yeah.
So then she consults like a fortune teller or astrologer occasionally, but she's talking to a professional. All right. Well, in that case, I agree with you. I mean, I think, we call it in English a self-fulfilling prophecy, right? It's like, if you believe in something, it's more likely to occur than if you don't, right? So it becomes self-fulfilling. The idea that you're going to die on a certain date, it's unlikely to happen. So I agree with you. But some people are a little bit delusional. They have a tendency to some people are naive. Some people are, willing to believe others and set aside their own, knowing. So this is a person that obviously needs some real, professional guidance for sure. Hey, I'm Dr. Brett.
Hey, I'm Shnaka.
Thank you.